Alright, I'm Alex, and this is my final head-to-toe video. I'm going to scan the room to show that I am not cheating. Okay. Alright, before I would enter the room, I would look at the chart, would wash my hands, then knock on the door, provide privacy. I'd introduce myself, ask the patient their name and date of birth.
Gage Belko, February 19, 1994.
Okay. And what brings you in today?
Just a physical.
Okay. Are you experiencing any pain?
No.
Okay. Can you tell me where you are currently?
In the hospital.
Okay. And what's the date today?
April 18th.
Okay. Patient knows where they are, was able to tell me who they are, and what date it is, so the patient is alert and oriented times 3. I'm also going to note posture is erect, patient is well groomed, and dressed appropriately for the occasion. I'm also going to note hair and skin at this point as well. Skin is appropriate for ethnicity. Pink undertones, macules across the body. We have a tattoo on the left forearm and on the upper shoulder. Hair is evenly distributed. There are no hair loss. It's thick. Eyebrows also are evenly distributed. There's no lesions or scaling. Skin is warm throughout the entire body. Hair is also evenly distributed on the legs. I'm now going to just ask some subjective questions for right now. Are you experiencing any vision problems?
No.
Any hearing problems?
Nope.
Experiencing any dizziness?
No.
No. Have you noticed any changes in skin, like mole size change?
Mm-hmm.
No. Having trouble breathing?
Nope.
Okay. I also would note that the patient's facial expressions are relaxed and no signs of respiratory distress. Are you having any back pain?
No.
Are you having regular bowel movements?
Yes.
How about urinary?
They're fine.
Okay. Are you having any discharge in your genitals?
No.
No. Do you use protective sex?
Yes.
Okay. Do you, what's your exercise routine?
3 to 4 times a week.
Okay. What's your normal diet?
Vegetarian.
Okay. Are you noticing any, like, heart palpitations or chest pain? And okay. Alright. I'm gonna now palpate the scalp and go from there. So, palpating the scalp, there's no lesions, bumps. Does it feel tender when I do that?
Mm-hmm.
No. Head is normal cephalic for the body. I'm now gonna just scan the face. Face is symmetrical. Eyes are let me set that over. Sclera is white. Eyes are blue. Conjunctiva, I'm going to pull down your words real quick. Okay. Conjunctiva is pink and moist. I would also look at the cornea and there'd be no opacities. Mouth is pink and moist as well. Can you open your mouth for me real quick? Okay. Tongue is pink and midline. More time. Pubic mucosa is pink. Hard and soft palate are pink as well. Teeth have mild dental work on them. Uvula is also midline. I'm also going to look at the nose real quick. Okay. Nares are bilaterally equal. There's no perfusion. Looks like the patient does have a septum piercing, but does not have that in currently. Ears are pierced, or they also have it taken out, but there is a clear piercing mark. Ears are also even color is evenly distributed as well, matches the rest of the skin. Okay. Let's have a think for a second. Okay, I'm gonna palpate the sinuses as well as test the temporal pulse. So I'm gonna test right here first. Temporal pulses are bilaterally equal, +2. And then I'm going to test the TMJ. You can open your mouth for me. Okay. And then can you move it side to side? Down. Okay, perfect. And then sinuses, yes. So you're going to feel a little bit of pressure. You shouldn't feel any pain, okay? Does that hurt?
Mm-hmm.
No? Oh, that? No? Okay. So now I would test for cranial nerve 5. I'm going to find my little thing here. Okay. When I touch certain spots on your face, just say now when you feel it, okay?
Mm-hmm.
Alright.
Now.
Okay.
Now.
Okay.
Now.
Okay. Cranial nerve 5 is intact. I would now move on to the eyes for a more in-depth look. I would use a Snellen chart if we had one, just to test for visual acuity and just to check if cranial nerve 2 was intact. Okay, I'm going to bring out my pen light real quick. Can you turn this way a little bit? Okay. I'm going to measure the pupils first. Okay, they're both 4 millimeters in diameter. I'm going to test for accommodation. Can you look that way for me real quick? Okay, then look at my pen. Alright, one more time. Can you look? Okay, now look at my pen. Okay. I'm also going to check for consensual and direct light. Okay. Pupils dilate consensually and direct with light. Now I'm going to have you follow my pen real quick. Okay, 6. Alright, 6 cardinal gazes were tested, so eyes are perla. I'm now going to move on to, eyes moved normally, so cranial nerves 3, 4, and 6 are intact. Okay, and then can you turn back to the camera real quick? Can I ask you to smile for me? Okay, close your eyes tight, and then open them again, and then raise your eyebrows. Okay, cranial nerve 7 is also intact. Now I'm going to move on to the ears. Okay, I'm going to just check real quick. I'm going to push on the tragus. Both sides, actually. And then pull on the pinna, and then press on the mastoid process. Does that feel tender to you when I do that?
Mm-hmm.
Okay. I'm now going to look in the ear. To look in the ear, if I had an otoscope, I would have the otoscope upside down, pull back, and then look. And then when I look, I should see some cerumen. And then when I get in deeper, see the tympanic membrane, it would have a pearly gray color to it, translucent. The light reflecting on it in the right ear would be at 5 o'clock. If I was looking in the left, it would be at 7. Are you experiencing any ear pain? I forgot to ask you that, or any ear infections lately?
No.
Okay. I'm gonna move on to the before I do that. Can you try to think? Can you stand up for me real quick? Alright. And then with your eyes closed, can you slightly tilt that? Okay. Other way. Okay. Alright, perfect. You can sit back down. I just tested the patient's balance, so did the Rhines test, so that would make cranial nerve 8 intact. I could also do the whisper test or something like that. I'm now going to look at the nose. Okay. Gonna look inside one more time. I would actually test. Sorry, let me start that over. I could test his sense of smell by having him smell something, but for purposes, I'm not going to have him do that. But that would be to test his cranial nerve 1, which was the olfactory nerve, and it would be intact. Okay, so I'm going to move on to the mouth real quick. So, can you say ah for me real quick? Okay. Uvula is midline. It goes up when he does that, which would indicate that 9 and 10 would be intact, the glosseopharyngeal and the vagus nerve. His tonsils were a +1. And then can you say light, tight, dynamite for me?
Light, tight, dynamite.
Okay. And so cranial nerve 12 is intact. His tongue is also midline when he sticks it out, so that also shows that cranial nerve 12 is intact. I'm now going to have him. Can you shrug your shoulders for me? Okay. Can you do it with resistance, against resistance? Okay. And then can you move your neck back, to the right and left? Okay. Cranial nerve 11, the accessory nerve, is intact with the patient doing that. Also, I forgot to ask, do you have any neck issues or any past histories?
No.
Okay. I'm now going to palpate for lymph nodes real quick. So, alright, right here, preauricular, postauricular, occipital, in the base of the skull, submental, submandibular, the tonsillar, superficial clavicular, the deep cervical chain, the posterior clavicular, and then right here would be the supraclavicular. Okay, none were palpated, so that's a good sign. I would also, I'm now going to check for his carotid pulse. Okay. Okay, carotids are +2. I would also check his thyroid gland real quick. I would have him just kind of lean his neck forward and then turn his head. Yep. Okay. I feel no masses or bumps. Just thinking. I would also check for bruise. I'm going to use my my bell. So when I check, I'm going to need you to take a big breath, but then the minute I listen, exhale and don't take another breath.
Okay.
I'll be quick. Alright, ready? Take a deep breath. Exhale. Okay, take a deep breath. Exhale. Okay. One more time, take a deep breath. Alright, and exhale. Okay. Alright, can you do that again for me? Okay. Thank you. No bruises were detected. So now, okay, I'm going to move on to chest. Before I do anything else, I would check for crepitus. It would be right about here. Okay. I feel nothing. There's no cracks or bumps. Can you, I'm just trying to think, can you turn? Maybe. Perfect. You're perfect. Okay. Sorry. Okay. So I just would, okay, yeah. Can you lift up for a second? Noting the chest, there's some macules. There is a tattoo on the right lower quadrant. Skin is warm to the touch and dry. I would also now listen to the heart sounds with my bell. Okay. I would start at find the sternal notch, go down to the intercostal space 2, and then listen. Okay, and I would go to the left to listen to the pulmonic valve, and go down to Erb's point. Okay, and then I would go down to the fifth midclavicular, right side, to listen to the tricuspid, and then finally the fifth midclavicular line for the mitral valve. Okay. I heard no murmurs or irregular heart sounds. Heart sounds 1 and 2 were intact, or not intact, sorry, were heard. I would also check the apical pulse in the fifth intercostal space. So, right about here. Sorry. Okay. Feeling right there. It feels normal. It's not irregular. There's no lifts or heaves. And before I forget, can I have you lay down real quick, like on your back?
Right here?
Yes. Just to assess JVD real quick. There's no JVD, but if we saw a little bit of bulging, I would raise the patient 45 degrees to make sure there was no JVD. Alright, can you back up for me? Thank you. I'm now gonna listen to the lung sounds starting above clavicle. Can you turn? Sorry. Like how you work. Perfect. Just take a deep breath, or just breathe normally. Or actually, sorry, breathe through your mouth. You're fine. Okay. Lung sounds were clear, no adventitious sounds, no crackles, no rhonchi. I'm now going to do the posterior chest. Can you sit the opposite way? Perfect. So right now I would check for AP diameter. I would go from right here to right there. Okay. AP diameter is 2 to 1. I'm now gonna go down to the about T10, and then can you take a deep breath for me? Okay. All right. Thumbs went apart, so that's a normal finding. Now I'm gonna check for tactile fremitus, and can you say feel my palms go down or touch your back? Can you say 99 for me?
Mm-hmm.
Okay.
99.
Okay.
99.
Okay.
99. 99.
One more time.
99.
Okay. Lung sound or sounds were diminished as we got lower. Let's see. I'm now gonna map out my lung field. I would start at C7, which is right there. I would find the scapula, which is about right there, and then go down a couple. So there's 8, 9, 10. Just about right there. As I'm noticing, skin is warm and dry to the touch. Macules distributed throughout the body, and now I'm going to listen. Okay. Here, can you turn a little bit more? There. Thank you. Okay. All right. Lung sounds were clear. No rhonchi or crackles in the posterior. And there's no adventitious sounds. I did forget one thing though. I'm gonna percuss the back as well, and also the front of the chest. Sorry. So, I'm gonna do that. Can you turn forward again real quick? Okay. Have to do. There we go. Okay. All right. Let's see. I'm now just going to move on to the arms. Skin is warm and dry right there. I'm going to assess the pulses real quick. Okay. Radial pulses are bilaterally equal, +2. I'm now going to check the brachial. Okay, pulses in the brachial are +2 and bilaterally equal. I'm now going to check for cap refill real quick. Alright, cap refill in the left hand is less than 3 seconds. I'm going to now check the right. Okay. Cap refill also in the right hand is less than 3 seconds. Can you pull my fingers for me? Not pull. Sorry, squeeze my fingers. Okay. Grip is strong. Okay, can you push on my hands for me? I'll just push it. Yeah. Okay, and then pull. Like that. Grip is strong. Strength in both arms are strong. I'm gonna now do the legs. Okay. Can you raise your right leg for me? Okay, and now your left. Okay. I'm gonna just check the popliteal pulses real quick. So behind the knee. Oh, that one's really strong. They're really hard to They are.
I've been on my feet all day.
Okay. So bilaterally +2. They're equal. I'm gonna now check for the posterior tibial pulse. Okay. Both are bilaterally equal as well. And now I'm gonna check the dorsalis pedis pulse. Okay. Okay. And then both are bilaterally equal as well. I would also check the cap refill. Alright, cap refill is also less than 3 seconds. Oh shoot. Okay, I'm gonna need you to push on my hands like a gas pedal. Okay, and then pull. Okay. Strength in the feet are strong. Before I move on to the abdomen, I should get into some range of motion. Can I have you stand up and walk for me real quick? Okay, just take a step, like a couple steps. Okay. Okay, you can sit back down. Gait is fluid, appropriate. Also, I would note throughout this process that the patient responds to commands, eyes are stimulated, and his verbal commands are a ×3, so Glasgow would be 15 out of 15. Oh, I have to test the Babinski, so this is going to be the best part. I'm going to run this along bottom of your foot to see for a reflex.
Great.
Okay. So, looks like that. Okay. No.
Okay.
Okay, toes curled. So it was a toes curled opposite of how the rest did, so it's a positive. Sorry for tickling you.
It's okay.
Lost my train of thought for a second. Let's see. I'm now just gonna assess the abdomen. Can I have you lay down? Okay. Sorry. Sorry. Okay, so noting the abdomen right now through the shirt, contour is flat. There's no distension. I'm now just gonna pull back. Noticing macules again, a little bit of hair distributed. So just inspecting. I would now auscultate for vowel sounds starting in the lower right quadrant. Okay, and then while I'm here, I would also check for the renal and iliac arteries and the aortic. Okay, bowel sounds were normal. There was no bruise. I took that way.
Oh
And percussed. And are you experiencing any pain?
man.
Okay. When I palpate, let me know if you're gonna feel any tenderness. But I'm gonna percuss first. Should hear dullness over, like right underneath the rib cage, along the liver. Okay, there's some flatness right there. Okay. And so now I'm going to palpate. I'm going to start off with light palpation. Does that hurt?
Mm-hmm.
No? Okay. Okay. Not feeling masses. Okay. And now I'm just going to deep palpate real quick. Going about 2 inches in. Okay. I kind of feel right there. A little bit of a mass, so you might be feeling that later. Okay. Can you get up for me real quick?
Mm-hmm.
Okay. So also throughout my assessment, I've noticed for his muscles, there's no masses in the muscles. There's no tenderness, or are you experiencing any joint pain or anything? Okay. Also, forgot, can you raise your arms up for me? Okay. Arms are bilaterally equal, and then you can put them down. Thank you. And then can you just stretch out your legs real quick one more time? Okay. And then legs are bilaterally equal as well. Just trying to think. Okay. So I think my assessment is done. So I would make sure the patient was tucked back in bed, with the railings up, wash my hands, thank him for letting me do this, go and document, and yeah.
Yay.
Well, thank you.
Thanks for the physical.
Yeah, you're welcome. Alright. Okay.